Hi friends, I am Dr. Rahul, Director of Hematology and Bone Marrow Transplant at Fortis Memorial Research Institute, Gurugram. We are going to talk about acute lymphoblastic leukemia. One fine day, your cell becomes immortal, white blood cells, and they are of two types, B and T. They become immortal and they start producing more cells. They start producing more cells, so the red blood cells goes down, the platelet goes down, and this rapidly expands, which can lead to the bony pains. This is called acute leukemia. To diagnose acute lymphoblastic leukemia, you need to suspect it first. And when do you suspect? Prolonged fever, pancytopenia, low hemoglobin, low TLC, low WBC or low platelet count, joint pains, body pains which is not being and unexplained for, recurrent fevers, weight loss, lymph node swelling which is there. These are the symptoms where you can present with. And once you present with these symptoms, what do? You get a CBC test done and let the pathologist see. If the pathologist sees blast, you do a test called bone marrow test, bone marrow aspiration biopsy. Even if the pathologist does not see, you do a bone marrow test. You do a bone marrow test if it's suspected. And on bone marrow test, always remember do a flow cytometry which will characterize between acute myeloid versus acute lymphoblastic leukemia. Acute lymphoblastic leukemia in two types, B and T, which will help you to design your therapy. And along with the cytogenetics and the NGS which has to be done to actually characterize the severity of the disease, that is good, bad. And that is why you require say around 30,000-40,000 or $500 to $800 just to diagnose it correctly. That's the most important thing, because whole treatment of chemotherapy versus transplant will depend on that. So again, ALL is good risk or bad risk, and the treatment is simple. Chemotherapy followed by bone marrow transplant if it is bad disease, or only chemotherapy plus the radiation therapy to the brain and the mediastinum if the mass is bigger. These are the modalities. So chemotherapy, radiation and bone marrow transplant remains the cornerstone for treatment of acute lymphoblastic leukemia. It is the commonest malignancies in pediatric. It is not so rare in adult side. In pediatric, 80%, 85% people do not require bone marrow transplant. In adult side, 50 to 60% people do require bone marrow transplant. So stay tuned, and if you have got anywhere you read this word or you hear this word acute lymphoblastic leukemia, please do contact us, because we will be able to help you out with the new medications, new combinations which promises the moon and also will deliver the moon. So please stay tuned, and all the very best.